February this year, health services in provincial, high-level and district hospitals had already been devolved. The headache was how to pay health workers' salaries in a non-existent finance management system. An understanding with governors that the national government take on that responsibility until February next year has been misunderstood, according to the Transition Authority, to mean that this is a latter who has been paying the medical practitioners to date.
Because the funds for the salaries are already with the governors. So it's only just a question of how you arrange the payroll and how you manage it. So we are calling it management of the payroll.
So come February, when the ICT structures are expected to be in place, medics will have no option but to embrace change.
Every employee who is on secondment will be required to indicate that they want to be in the service of the county governments. Once they do so, then they will be absorbed in those terms and conditions. They will abandon their former terms and conditions and become part and parcel of the new terms and conditions of service.
We are doing rationalization to ensure that staff are deployed according to needs, not according to where they come from. And I think the guidelines that we are going to provide will ensure that nobody is disadvantaged and that counties don't just employ anyhow.
It is this move that has caused a panic. Medical practitioners fear that their jobs and pay will depend on the whims of the governor.
There is an unwarranted fear on the part of professionals, health professionals. The principle of human resource management is that you should not be subjected to any loss of your earned benefits. And I'm happy that the governors have embraced that principle, and they are not likely to interfere with the earnings or the payroll.
And the professional cadres are not going to be treated the way we were doing when we were recruiting executive committee members, because that was the only leeway the governors had in terms of looking locally to see how they can equalize.
Transition Authority says that the Constitution and Salaries and Remuneration Commission will ensure that doctors are not forced to take pay cuts.
The professionals who have come from government will be deemed to have been seconded to the county governments. Therefore, they are not likely to lose anything. They will retain their emoluments, they will retain their benefits, they retain their pensions without anybody affecting them.
A technical committee is finalizing the draft health policy and a health bill that not only specify the standards and norms, define their benefits and entitlements, but also harmonize the grading structure and pension schemes across all counties.
It is going to be very difficult for the governors only to concentrate on their people. Otherwise, some counties that do not have these people will suffer. So when it comes to rationalization and the deployment of staff, which the summit has already agreed that it will be a joint venture, the systems will ensure that people are rationalized across board.
And so, as far as the Transitional Authority is concerned, the strike is not only premature, but also futile. Devolution is one of the protected chapters in the Constitution, meaning a referendum would be required to stop its implementation.
Resources follow function. So those doctors who are performing functions that have been transferred will move with those functions. The money that was used to carry out those functions will move with those functions. Yeah, but if a doctor opts, or a professional staff opts not to be transferred with the function, then they make life a bit difficult for themselves.
The question is, what is urgent? For health functions to be devolved? Or would it have been more prudent to put the required systems in place before allowing counties to take on the responsibilities?
Why should we prolong? Everybody should put in place what is required to be in place and ensure that the systems are working, because the functions have already gone. So what are we waiting for?
In the health sector, only the KEMSA and vaccine services remain at the national government.